Next up, we're going to go over the order screen, and we have the order screen here. You notice there's this icon here at the top that looks like a prescription bottle with RX. You'll use that anytime you enter either home meds or you order a medication for the patient or prescribe a medication for the patient. That's your add medication icon. Now here, the search box, search orders and sets. That's anytime you're going to use that anytime you order a diagnostic, you order a lab, any point of care, so even immunizations and even a medication you're going to administer in the office, all gets ordered under that search orders / sets box. Down here we have manage medications. That's where we can expand this accordion and see our medication list, and we'll kind of go through that in the next couple sections. Then also manage orders. So this is once we have ordered, we can see what we order. We'll also go in here to add our diagnoses or additional information and sign off on our orders here under manage orders. Down here, this list of several in green common order sets. These will be orders that we have based on volume, ran reports, and added these order sets to your list. So you'll be able to see like common CT orders. We have a list of 10 or so of the most common that are ordered. So rather than searching for those, you can just expand this accordion and search for them and click on the box. So we've tried to make that a little easier for you. You can also, throughout the course of your use of the system, create your own favorites based on what you do in your daily practice. To order a medication, we click here on the pill box, and let's say I want to add a lisinopril for this patient. I start typing the name and hit enter, and it'll bring up my options. I'm going to give my patient 20 milligrams daily. Now note, we have the feeding tube options. We do share this dictionary with the hospital, so you do end up with some feeding tube, a lot of feeding tube options. That's something we really can't do much about for right now. So just make sure you search and find the right route for your med. We have the option to either make this be an RX, a prescription that we're going to order for the patient, or we can put in the information as reported. So if the patient told us they took this and we're trying to reconcile their home med list. For this one, I'm going to pick that I'm going to order it. Pick lisinopril 20 milligrams QD. It is giving me a conflict here. It's telling me that my lisinopril interacts with their ibuprofen that they've given us as their home med. I can override here, say physician approved, and it's going to ask me how many to prescribe and whether I want to give any refills. If I had any special instructions for the pharmacy, I could put it here, or any other kind of notes. I can either queue, which means I can go ahead and put that in the list to be signed, and then enter another one, or I can queue and exit. So it's up to me. I'll go ahead and queue and exit, and then it'll open up my medication list. You'll see that I have all the medications that my patient takes and has had, and then I have my new one here listed as new. If I go ahead and sign this order, enter my PIN and hit sign, it's going to ask me, it's going to tell me what it's going to do with it. So it's going to print a prescription, again because we don't have either this patient doesn't have a pharmacy set up in the system, or we don't have that set up for it to automatically flow to the pharmacy. So it's going to ask me to print the med. Print it. Go ahead and say OK. And then now it gives me that date of 4/10 that my lisinopril was prescribed. Now some more detail around the medication list. If I open up this Atrovent here, you see that this was reported on March 14th. So we recorded that as a reported from the patient. If we wanted to prescribe that, we just click the prescribe button here, and again it'll take us through that same screen where we can put in the amount, the number of refills, and then queue and exit. And then again we can sign. And then it updates with my new date. Same thing with refills. So we just prescribed this lisinopril, but we do have the refill option here. So once we prescribe something, we have the ability to refill it, stop it, hold it, whatever we'd like to do with it. Now to reconcile our med list, we can just click on the red icon here, this reconcile, and it'll give us our medication list. Any meds that we want to maybe stop, we just can click the little caret next to the name, and we have the ability to hit stop. And we can say why. When we complete the course, patient's not having that pain anymore or coughing, so we can cancel that one. We can either confirm individually, or we can confirm all. Now the two that we've already prescribed, it's already indicated that we have those confirmed. So let's say we want to confirm the rest. We just click confirm all. And then we save. And it'll take us back. And it'll tell us that we last reconciled our meds on April 10th. For non-medication orders, we have a couple of options. We can either search up here in the order/order sets for our order options. So let's say I wanted to order a chest x-ray. Hit enter. And I have my option here that I can select and hit save. The other thing that I can do is I know that I have these common orders here. So if I open my common rad orders, here's my chest 2 view here. Now to order from this list, I just would click on the button. Now remember, we have the shortcut. If we highlight first a problem from the problem list in green and then go to order one of our options here, it will associate that problem with the order, and you won't have to enter the diagnosis when you go in to sign off on the order. So I've ordered a couple things here, both one from actually searching and one from the order set. If I go down here, we also have for you created a list of common office, both injections and office labs, that you can order directly from the order set, just like you do the others. So again, we have our hypertension listed here. I'll go ahead and say I'm going to do an A1C on this patient. And what that does is once you order, it puts those orders in the manage order function. So if we go up here to manage orders, it'll show us that we have 3 new orders that are waiting for us to sign off on them. If we expand the accordion here under this chest 2 view, you see we have the red star here. It's letting us know that we have something required. We have some required information. So the chest 2 view, it wants to know when we want to get that done. So let's say we told them to go in the next 2 weeks. So we'll do T+14, and I'll put in that date. And then let's say for diagnosis, we want to say chest pain. And then we've associated a diagnosis, and now all of our red stars are gone. We can then sign off on it, enter our PIN. And then we've submitted those orders, and they go down on our active order list, and they should also be here on our outstanding imaging orders. We have them listed here.